The Somali population in Omaha, Nebraska, stands at 1,670 individuals based on city-level estimates from late 2025, while broader Douglas County data, which encompasses Omaha, records 1,948 Somalis. This figure positions Omaha as the primary hub for Somalis in Nebraska, where the statewide total ranges from 2,404 to 2,959. Settlement began in the early 2000s via federal refugee resettlement initiatives coordinated by the U.S. Department of State and the Office of Refugee Resettlement within the Department of Health and Human Services. Initial arrivals often landed in other states before secondary migration to Nebraska, driven by factors such as job availability in sectors like meatpacking. Federal allocations for refugee programs in Nebraska amount to $10 million to $15 million each year, covering costs for cash assistance, medical aid, and employment support during the first 8 to 12 months post-arrival. Somalis, comprising 10 to 20% of the state's refugee demographic, receive a prorated share of these funds, which are distributed through local agencies for housing placements and basic needs. Government support spans multiple levels, including federal programs like the Matching Grant Program for Self-Sufficiency, state-administered initiatives through the Nebraska Department of Health and Human Services Refugee Resettlement Program, and local contributions from the city of Omaha and Douglas County. Somalis access the Child Care Subsidy Program, funded by the Federal Child Care and Development Fund, enabling enrollment in licensed facilities such as Accra Daycare and Preschool and Zamzam Daycare LLC, which handle capacities up to 10 to 12 children aged 6 weeks to 13 years. Estimates suggest 700 to 1,250 Somalis in Omaha utilize some form of assistance, including SNAP benefits or Medicaid, linked to employment in low-wage roles and average family sizes of 4 to 6 members, with 30 to 40% of the population under 18 years old. City allocations under the American Rescue Plan Act total $112 million in federal funds, with $9.7 million in loans and $1.3 million in grants directed to nonprofits from 2022 to 2024, indirectly aiding refugee households. Douglas County distributes $166 million in similar federal funds, including $950,000 in Title II grants subgranted to immigrant programs. Private funding augments these public inflows, with the Omaha Community Foundation providing $165,000 in 2024 and $120,000 in 2025 through its Refugee Community Grant Fund, awarding $7,500 to Somali Community Services for career training and a combined $27,500 to Restoring Dignity across 2024 and 2025. Other foundations contribute specific amounts, such as Sherwood Foundation's $330,000, Lozier Foundation's $38,000, and Front Porch Investments' $234,000 to Restoring Dignity in fiscal year 2022. Tax filings show Somali Community Services with $141,928 in revenue for 2020, all from contributions, and expenses of $122,452. Restoring Dignity reported $1,172,125 in 2023, with $1,094,297 from grants. This essay maps out the financial support sources and volumes for the Somali population in Omaha, detailing government and private contributions alongside their use in employment, businesses, charities, education, and health services, grounded in program data and filings. Demographic and residential utilization of resources. The Somali population in Omaha resides mainly in north and central areas, with concentrations in zip codes 68131, 68111, and 68110, where housing costs are lower and access to services is available. Douglas County, which includes Omaha, hosts 1,948 Somalis, and local housing assistance programs, funded by federal sources like the Office of Refugee Resettlement, allocate resources for initial placements. City of Omaha American Rescue Plan Act funds, totaling $112 million in federal allocation, include $9.7 million in loans and $1.3 million in grants to nonprofits, some of which support refugee housing indirectly through agencies serving Somalis. These funds are part of broader allocations, with Douglas County distributing $166 million in American Rescue Plan Act resources for similar purposes, including aid to nonprofits that handle refugee needs. The prorated share for Somalis, as 10 to 20% of Nebraska's refugees, draws from the state's $10 million to $15 million annual refugee budget, covering housing in these ZIP areas. Residential patterns center on streets like Northwest Radial Highway in the 1016 to 1608 blocks, 25th and Farnham, and Douglas Street in the 2400 to 2500 blocks, with neighborhoods such as Long, Orchard Hill, and Jefferson Square serving as key locations for Somali households. County funds like the $950,000 from the Office of Juvenile Justice and Delinquency Prevention Title II grants sub-grant 1/3 to immigrant organizations, which can benefit Somali youth in these residential zones through program costs. Family breakdowns show 35 to 50% as married couples with children under 18, 13 to 20% in other family households, and 19% as individuals, with adults at 60 to 70% and children at 30 to 40%. These structures influence resource use, such as state and federal subsidies for childcare, where providers like Edu Care Omaha receive Head Start funds to serve underserved families, including Somalis. Nebraska Department of Health and Human Services oversees these subsidies, with statewide refugee funding at $10 million to $15 million annually, prorated for Somalis based on their demographic share. The Child Care Subsidy Program allocates federal child care and development fund resources to facilities like Accra Daycare and Preschool and Zamzam Daycare LLC, which handle capacities for children aged 6 weeks to 13 years, with subsidies covering costs for eligible Somali families. In Omaha, this forms part of the overall $2 million to $5 million prorated annual government support, layered as federal at 60%, state at 20%, and city or county at 10%, with the remainder from private sources. These allocations fund daily living expenses in the specified residential areas, where Somali households utilize them for rent, utilities, and family-related costs. Total government support for residential and demographic needs includes the $235 million in 2024 North-South Omaha Recovery Grants under LB 1024, with portions directed to housing for refugees in North and Central Omaha. The $2 million in 2024 Omaha Recovery Grants to Lutheran Family Services specifically targets refugee housing, prorated for the 1,948 Somalis in Douglas County. Private supplements, though not detailed here, make up the balance in the funding mix. Residential utilization covers the 1,670 city-level Somalis, with funds applied to maintain households in zip codes 68131, 68111, and 68,110, and streets like Northwest Radial Highway. The $950,000 Title II grants from the county further allocate resources to youth programs in neighborhoods like Long and Orchard Hill, sub-granting amounts to immigrant organizations. Overall, these financial inflows ensure coverage for the population's residential needs, with federal sources dominating at 60 to 70% of the total $2 million to $5 million annual prorated amount. Government funding sources and amounts. Federal funding forms the bulk of support, with the Office of Refugee Resettlement allocating $1.8 billion nationally in fiscal year 2019, and Nebraska's share at $10 million to $15 million for programs like reception and placement, where Somalis qualify for cash and medical aid. The Refugee Job Training and Placement Program, administered by the Nebraska Department of Economic Development, uses American Rescue Plan Act recovery funds for grants up to 2026, with individual awards of $50,000 to $200,000 to nonprofits serving refugees. In Omaha, this supports employment training, with 70 to 80% of funds from federal sources, prorated for Somalis as 10 to 20% of the refugee demographic. The matching grant program provides additional federal aid for self-sufficiency, covering costs for the first 5 to 8 months, part of the overall $10 million to $15 million Nebraska allocation. Federal pass-throughs also fund the Child Care Subsidy Program via the Child Care and Development Fund, where daycares accept subsidies for Somali families. These federal amounts layer into the total $2 million to $5 million prorated annually for Somali-serving programs in Omaha, with federal comprising 60 to 70%. State-level funds pass through the Department of Health and Human Services Refugee Resettlement Program, fully federal-backed, providing self-sufficiency aid for the first 5 years, including $2 million in 2024 Omaha Recovery Grants to Lutheran Family Services for refugee housing. The North-South Omaha recovery grants under LB 1024 total $235 million in 2024, with portions directed to refugee-serving entities, administered by the state. State coordination of federal funds includes the $10 million to $15 million annual budget, with 10 to 20% state share in the overall mix. The Nebraska Department of Economic Development handles the Refugee Job Training and Placement Program grants, awarding $50,000 to $200,000 per entity, part of the American Rescue Plan Act recovery allocations up to 2026. State funds also oversee child care subsidies, where providers like Edu Care Omaha access Head Start federal funds routed through state channels. This state portion accounts for 10 to 20% of the $2 million to $5 million prorated for Omaha programs. City of Omaha contributes via American Rescue Plan Act distributions, awarding $9.6 million to 36 nonprofits from 2022 to 2024, though no direct Somali organization recipients are listed, with $112 million total in federal allocation for the city. Douglas County allocates federal funds, such as $166 million in American Rescue Plan Act for nonprofits, including refugees, and $950,000 in Title II grants subgranted to immigrant youth programs. Local shares make up 5 to 10% of the funding breakdown. These funds cover resettlement, job support, and housing, utilized by an estimated 80% of the Somali population in some capacity, with the total prorated at $2 million to $5 million annually across levels. Private funding and charitable operations. Private funding accounts for 60% of resources for Somali organizations, with the Omaha Community Foundation's Refugee Community Grant Fund awarding $165,000 in 2024 and $120,000 in 2025 to refugee serving groups, including $7,500 to Somali Community Services and $27,500 total to Restoring Dignity. United Way of the Midlands provides over $40 million metro-wide through campaigns, indirectly supporting Somali programs via partnerships. Sherwood Foundation granted $330,000 to Restoring Dignity in fiscal year 2022, while Lozier Foundation contributed $38,000, Front Porch Investments $234,000, and White's Family Foundation $10,000 to $20,000. These private inflows total under $2 million annually across groups, used for program services and administrative costs. Somali Community Services focuses on immigration and cultural support with its $141,928 revenue, all from contributions. Restoring Dignity allocates its $1,172,125 revenue, 93.4% from grants, to home services. Somali Community Services reports $141,928 in revenue for fiscal year 2020, all from contributions, with expenses at $122,452 and net assets at $19,476. Restoring Dignity had $1,172,125 in revenue for fiscal year 2023, with 93.4% from grants, $1,094,297, and expenses at $903,455, net assets $474,728, including $55,866 in government grants. Other groups like Somali American Heritage Society and Somali Bantu Community of Nebraska operate under $50,000 annually, funded by donations. Heel Vol Association relies on private donations with no detailed figures. These revenues support operations in employment assistance, education, and relief, with private sources dominating for smaller entities at 90% or more. Private sources mix 5 to 10% public funds for larger ones, with no government grants detailed for some. The Omaha Community Foundation Awards include $10,000 to Somali Community Services for immigrant assistance and $6,652 to Restoring Dignity for clinics. United Way's $40 million supports community investments, with portions to refugee services. Sherwood, Lozier, and others provide specific amounts to Restoring Dignity, totaling $857,598 in private grants for 2022. These funds cover administrative and program costs, with total private inflows under $2 million annually. Educational and child care resource allocation. Somali students in Omaha attend public schools within the Omaha Public Schools District, with notable concentrations in north and central areas where the population density is higher in zip codes like 68111 and 68131. Elementary schools such as Kellam in 68131, Conestoga in 68111, and Kennedy in 68111 serve significant numbers of immigrant students, including Somalis, and receive federal and state funds designated for English learner programs to address language needs among diverse populations. Middle schools like Lewis and Clark in 68131 and Macmillan Magnet in 68112 also enroll Somali students, with allocations from federal sources supporting curriculum adaptations and additional staffing for non-English speakers. High schools including Omaha North in 68111 and Central in 68131 handle older Somali students, where state and federal education funds cover costs for programs serving refugees and immigrants. The Child Care Subsidy Program, funded by the Federal Child Care and Development Fund, provides financial support for daycares, with providers like Accra Daycare and Preschool and Zamzam Daycare LLC accepting these subsidies for families with children aged 6 weeks to 13 years, covering capacities up to 10 to 12 children. Nebraska Department of Health and Human Services administers these subsidies, drawing from the statewide $10 million to $15 million annual refugee budget, prorated for Somalis as 10 to 20% of the demographic. These funds total part of the $2 million to $5 million prorated annually for Somali-related programs in Omaha, with federal contributions at 50 to 70% for school and subsidy initiatives. Learning centers operated within community organizations allocate portions of their revenues to English classes, tutoring, and skill-building sessions, as seen with Somali Community Services using parts of its $141,928 revenue from fiscal year 2020 for such educational activities. Broader providers like Care Omaha, with multiple locations in North and South Omaha, access federal Head Start funds to deliver early learning programs for underserved families, including Somalis, focusing on children in households averaging 2 to 4 kids. No Somali-owned daycares are listed in public records or statewide rosters from the Nebraska Department of Health and Human Services, but general facilities serve the population without dedicated grants for Somali-specific operations. The statewide roster of licensed childcare facilities, available as PDF resources, shows no explicit Somali-linked entities, yet subsidies from the Child Care and Development Fund flow to providers like Kids Can Community Center for preschool and family support in North Omaha. These educational resources utilize government funds layered as federal at 60%, state at 20%, and local at 10%, with the total prorated at $2 million to $5 million annually for the Somali community. Utilization rates align with the 30 to 40% of the population under 18, ensuring coverage for tuition subsidies and program costs in schools and daycares. Funding for education and childcare encompasses federal allocations like the $1.8 billion National Office of Refugee Resettlement budget from fiscal year 2019, with Nebraska's share at $10 million to $15 million, including components for youth and family programs subgranted through Douglas County at $950,000 via Title II grants. These amounts support English learner initiatives in schools like Kellam and Omaha North, where diverse enrollments require additional resources. Private supplements, though minimal in this sector, may include foundation grants, but the bulk remains public, with 50 to 70% federal for school programs and subsidies. The Nebraska Child Care Referral Network lists providers accepting subsidies, such as Heartland Child Care with multiple locations, serving Somali families alongside others. Overall inflows for this category form part of the $2 million to $5 million prorated total, covering operational costs for education utilized by Somali households with average sizes of 4 to 6 members. Health and specialized services funding. No Somali-owned medical centers are documented in Omaha, with the population accessing general facilities like Charles Drew Health Center for primary care, dental, and behavioral health services, funded by federal qualified health center allocations. The Monroe Meyer Institute provides autism assessments and treatments, including diagnostic clinics and behavioral therapy, with state and federal programs covering costs for developmental services. Autism care extends to centers like Autism Center of Nebraska, offering residential and vocational programs, and Inner Circle Autism Network for applied behavior analysis therapy, all utilizing government funds without dedicated Somali facilities. Home health services through a case home health care include multilingual support for nursing and therapy, potentially addressing developmental needs, with funding from Medicaid and other public sources. Nebraska's refugee programs allocate $10 million to $15 million annually, including health components prorated for Somalis at 10 to 20%. These services draw from the overall $2 million to $5 million prorated for the community, with government at 30% for broader refugee health. Federal funds support initial refugee health screenings upon arrival, covering medical exams and vaccinations, with ongoing care through Medicaid, where rates for similar populations range from 42 to 75% receiving aid. Facilities like South Omaha Medical Associates provide primary care and immigration physicals, funded by bilingual practice allocations, while sharing clinics at the University of Nebraska Medical Center offer free or low-cost services with federal backing. No specialized Somali autism centers exist, but providers like Lighthouse Autism Center fuse therapy with speech services, accessing state funds for children with special needs. The Children's Respite Care Center handles skilled care for developmental issues, with subsidies from public programs. These health resources utilize mixed funding, with total health-related spending part of the $2 million to $5 million overall, and private grants for specific components. Government contributions for health include the Office of Refugee Resettlement's national $1.8 billion allocation, with Nebraska's $10 million to $15 million share covering screenings and aid, prorated for the 1,670 to 1,948 Somalis in Omaha. Douglas County and City of Omaha channel Federal American Rescue Plan Act funds, such as $166 million countywide, toward nonprofits for health services. Private elements, like $55,866 in government grants within Restoring Dignity's $1,172,125 revenue, mix with public at 30% for refugee health. Facilities like Al Rama Masjid may link to community health outreach, but direct funding goes to centers like Charles Drew for preventive care. Overall, these allocations cover therapy, screenings, and ongoing needs for the population. Business and employment financials. Somali-owned businesses in Omaha generate revenue primarily from customer sales, with food sector operations like Hanat Restaurant at 2425, Douglas Street offering halal meals and earning through daily transactions. Huyo's Kitchen and Grocery at 1016, Northwest Radial Highway provides dishes and staples, family-run with sales as the main income source. Wamo Restaurant and Coffee at 1608, Northwest Radial Highway focuses on halal options, while Zaytuna operates as a mobile food truck with revenue from varying locations. These businesses, often small and family-operated, have no documented specific grants, but may access minority business loans from the Nebraska Enterprise Fund, which offers up to $10.5 million statewide for underserved enterprises. Employment in meatpacking and food processing sectors utilizes federal and state training funds, with 80% of Somalis in such roles, drawing from the Refugee Job Training and Placement Program's $50,000 to $200,000 grants. These inflows form part of the $2 million to $5 million prorated government total, with federal at 60 to 70%. Business revenues stem from customer transactions, with self-employment rates at 5.7% in comparable groups, and operations clustered in areas like Northwest Radial Highway. Unemployment impacts 10 to 20% of the population, leading to reliance on assistance for 700 to 1,250 individuals, supplemented by wages from low-paying jobs. The Nebraska Enterprise Fund provides loans for minority-owned firms, potentially up to portions of its $10.5 million pool for Somali businesses. Overall economic inflows include these wages and sales, with government allocations totaling $2 million to $5 million prorated annually, layered as federal 60%, state 20%, and local 10%. These funds support training and startup costs where applicable. Employment data shows 80 to 90% participation in sectors like production and material moving, with 10 to 20% unemployed, contributing to aid utilization. Businesses like Hanat and Huyo's operate without detailed grant records, but comparable minority programs offer access to equitable capital. The Midlands African Chamber may provide additional support, though not quantified. Total inflows blend sales revenue with assistance, where 700 to 1,250 on aid receive SNAP or Medicaid, part of the government allocations. These financials cover the 1,670 to 1,948 Somalis, with business operations in food sectors generating daily revenues. Conclusion. Summary of Somali funding sources and resource distribution. Government funding for the Somali population in Omaha comes from federal, state, and local sources, directed toward resettlement efforts, subsidy programs, and various support initiatives. Federal contributions form the largest portion, handling core aspects like initial cash and medical assistance through agencies such as the Office of Refugee Resettlement. State involvement focuses on coordination and pass-through mechanisms via departments like Health and Human Services, ensuring distribution for self-sufficiency programs over the first several years. Local funds from the city and county supplement these, often through recovery grants and allocations to nonprofits that aid housing and community needs. Private funds from foundations enhance these public inflows, supporting charitable operations in areas like career training and home relief. Together, these resources address the needs of the population in residential setups across north and central areas, where concentrations exist in specific zip codes and neighborhoods. The layered funding structure ensures coverage for housing placements, utility assistance, and family-related costs, utilized by households with typical structures of married couples, other family types, and individuals. This allocation system reflects a standard approach for refugee groups, with public dollars accounting for the majority while private additions fill gaps in specialized services. Activities funded by these resources encompass business operations, community services, and educational programs, where organizations allocate inflows to cover administrative and program expenses. Business ventures, often family-run in the food sector, generate revenue from sales and may access loans for minority enterprises, contributing to economic participation. Community services include immigration aid, cultural support, and relief efforts, with organizations like Somali Community Services and Restoring Dignity using their revenues for these purposes. Educational resources support English classes, tutoring, and early learning through subsidies to daycares and schools, serving the younger segment of the population in households with multiple children. Employment centers on processing and material handling jobs, where training programs funded by recovery grants assist placements, though a portion of the population relies on aid due to unemployment or low wages. Health services utilize general facilities for primary care and specialized needs like autism assessments, with screenings and ongoing aid covered by public programs. These activities collectively utilize the available funds to maintain daily operations and support the population in residential, economic, and health domains. This funding and resource utilization supports individuals in Omaha across various areas, based on demographic data showing concentrations in specific neighborhoods and family compositions. Residential support ensures access to affordable housing in zones like those around certain highways and streets, where local grants aid nonprofits in providing placements. Economic activities, including self-employment in restaurants and groceries, draw from sales while training funds help in job sectors like meatpacking. Community and charitable operations, funded by a mix of public and private sources, cover expenses for services that address immigration, education, and relief needs. Health allocations provide for screenings and care through centers offering primary and developmental services, without dedicated facilities for this group. The overall system prorates resources according to the population's share in statewide refugee demographics, ensuring distribution for the group in Douglas County and Omaha proper. In summary, the financial allocations combine government sources at federal, state, and local levels with private contributions from foundations, utilized for a range of programs and services in Omaha. These inflows cover resettlement, subsidies, housing, employment training, education, health screenings, and charitable operations, supporting the population's activities in business, community engagement, and daily needs. The structure reflects standard refugee support mechanisms, with public funds dominating and private additions enhancing specific entities. This setup addresses the requirements of households and individuals in designated residential areas, facilitating participation in local economies and services based on available program data.